Good afternoon to you all. I'm Dr. JP Singh. Welcome back to our channel. In continuation of our previous lecture on drowning, this is part 2 of the same lecture. In previous lecture, we discussed about the circumstances of drowning and what is the freshwater drowning and saltwater drowning. Moving ahead, now we have recovered a body from the recovered a body from the drowning. So, what are the post-mortem appearance? What of a case of drowning? The signs in a body which is recovered from drowning, they are very variable, and there is no sign which is pathognomic of drowning. That means there is no sign which will differentiate or which will designate a case to be a case of drowning. So the postmortem staining, which is generally seen in case of drowning, it is light pink in color, which resemble at times the postmortem staining of carbon monoxide poisoning, and it is because of the unreduced hemoglobin in the upper layer of skin. The postmortem staining is generally seen on face, upper chest, hands, forearms, legs, and the feet. Why it is seen on face, upper chest, hands, forearms, legs, and feet? Because of generally this appearance of the body. This area, and this area. Since these are the dependent parts of the body, in case of drowning, this is the fluid where the body is lying. So in these parts, we'll see the postmortem staining. And the postmortem staining here will be light pink in color. And the pupils of the individual, they are dilated with the tongue swollen and coming out of the mouth. The rigor mortis in such cases appear early. Why it appears early? It is because of agitation. Before drowning, the rigorous activity of the individual before drowning, it takes away all the ATPs. Hence, the absence of ATPs hastens the process of rigor mortis. Next slide talks about the froth found in drowning. It is the froth found in drowning. We find the froth to be fine, white, and leathery. It is fine first, second white, and leathery. Generally, it is white, but it may be blood stained at times. It may be blood stained at times because of the rigorous movement or churning of the fluid inside the respiratory tract, and it is present at mouth and nostrils, as it can be seen here in the picture. It is generally present at the mouth and the nostril. It is one of the most characteristic external sign of drowning. It is characteristic but not definitive. It is characteristic but not definitive, right? But the character of froth in drowning is, as discussed, fine, white, and leathery. The froth consists of protein and water from the respiratory tract, and the water from the external source, and the fine bubbles in this froth, they do not collapse when touched with a pointed object. They do not collapse when touched with a pointed object. This is because of presence of surfactant, which increases the surface tension. Hence, these bubbles do not collapse when they are touched with pointed object. Generally, the froth is white but may be blood stained as mentioned, and it is more common in seawater. This froth is more commonly seen in seawater, vis-a-vis it is low or less found in freshwater. Why it is less found in freshwater? Please find out and write me in the comment box. If it is not, also write me in the comment box. I'll explain the same feature. If another character of froth in this drowning is, if this froth is wiped away, it gradually reappears because of continuous formation of the froth in the respiratory tract. The differential diagnosis of the froth, which is in drowning, it should be differentiated from the froth in cases of strangulation, where it is generally blood stained, or epileptic fit. Here also it is blood stained, but it not come again. As in drowning, it comes again when we remove it or when we try to wipe it out. In epileptic fit or strangulation, it will not come again. In opium poisoning, it is also there, and putrefaction. Now next term is cutis anserina. What is cutis anserina? It is the goose skin or goose flesh like appearance of the skin in cases of drowning. The skin is granular or puckered in appearance, and it is generally seen on anterior surface of the body. This anterior surface of body means the surface which comes in contact first time in the body, first time with water, right? It is called the cutis anserina. It is due to spasm of the muscles at the base of the hair, skin hair. It is due to spasm of that muscle when it comes in contact with cold water. In last discussion, we discussed what do we mean by cold water. It is the difference of around 5 degree between the body temperature and the water where the body is submerged. The difference should be around 5 degree. And it is rarely seen in India because because of presence of warm water, it is rarely seen in India, but it may be seen in cold areas. Because of same reason, there is retraction of penis and scrotum, and it's a reactionary phenomenon. It is reactionary phenomenon because the body, when exposed to cold water, it will show the appearance of cutis anserina, but not in presence of warm water. This is appearance of cutis anserina on skin on anterior surface. Cadaveric spasm. Another characteristic finding which we see in cases of drowning is cadaveric spasm. It is instantaneous form of rigor mortis. We all know what is rigor mortis. If it is not clear to you, please write in comment box. I'll explain what is rigor mortis. So cadaveric spasm is an instantaneous form of rigor mortis which occurs at the moment of death. It just occurs at the moment of death, and it reflects intense physical exertion or final desperate struggle of the drowning person. It is intense physical exertion, right? So there is consumption of ATPs at very high pace. It is also called as the death grip. It is the grip just before the death of the individual. The muscle where the action is taking place, they remain in contracted state without passing a normal phase of primary relaxation. We all know before rigor mortis appears in a body, there is a phase of primary relaxation which is further followed by final rigor mortis, and rigor mortis is destroyed or further it is inactivated by putrefaction. So in this phase, in this cadaveric spasm, there is no normal phase of primary relaxation. Hence, it causes items to be firmly held. Instantaneous rigor. It is also called as instantaneous rigor. It is typically seen in the hands and forearm, which are trying to hold something when the body is drowning, and captures the last action. This activity, this cadaveric spasm, it shows the last action of the individual, such as clutching sand, root, or the debris. It means whatever is coming in the hand of the individual, he'll try to capture that. The weeds, gravel, grass, sticks, twigs, anything from water may be grasped firmly in the hand in an attempt to come out of water and save himself. And it strongly suggests the person was alive. The person was alive when drowned. It shows struggle of person before death. Distinction from rigor means, unlike rigor mortis, normal rigor mortis, which occurs hours later, it is instantaneous or immediately. It occurs immediately. Now, washerwoman's hand. Another term which is another character which is generally seen in cases of drowning is washerwoman's hand. It is called as washerwoman's hand, but it may be seen on the foot also. What is this? It is absorption of water in the outer layer of skin. It is absorption of water in the outer layer of skin, leading to shortening of skin, and the appearance is generally wrinkling of skin. It is the skin appears wrinkled due to bleaching of epidermis, which is around at 4 to 8 hours after drowning. The skin is bleached, wrinkled, and shortened. These all things they take place at around 24 hours after drowning. If the body is in the liquid for around 24 hours, the bleaching of the skin, wrinkling of the skin, along with shortening of the skin appears. The white, sodden, thickened, and wrinkled skin, all these appearance, when they are together, they are called as washerwoman's hand. Here we see wrinkling, shortening, whitening of the skin. It is called as washerwoman's hand. There is draining of blood from the skin, and the skin is wrinkled. We see here the skin is wrinkled at the tips also. The timing for this is not accurate because it will not help us in finding the time since death or the time of drowning, because it is variation, the appearance of variation in the environmental condition. It is very dependent on the variations or dependent on the environmental conditions. So it is variable and it is non-diagnostic of the timing of the drowning. Internal changes, moving from the external changes to internal changes in the body. Firstly, we'll talk about lungs. The lungs, they are voluminous, that means increase in volume, and may completely cover the pericardial sac. That means in the respiratory tract, since there is covering of ribs on the sides, they generally move towards the center. Lungs move towards the center and they cover the whole pericardial sac. And on removal of the sternum, there is what is called ballooning. It is just the inflation of the lungs because of entry of the external liquid. And because of such ballooning, there are impressions. There are impressions of the rib on lateral surface. On these sides, we'll see impression on the lungs of the ribs. The lungs, they are held in apparent inspiratory position. The position of inspiration, because there is ballooning, there is increase in size of the lungs. They are seen in apparent, not actual, but apparent inspiratory position. There is a term called emphysema aquosum. It is seen in 80% cases of drowning when the individual is alive at the time of drowning. Because of aspirated fluid, there is increased formation of the mucus and froth. Mucus and froth, they create a wall mechanism, and the wall, it inhibits the airway. There is no activity of expiration. So an apparent inspiration, here we said apparent inspiration, the valve mechanism, it closes the expiration, and there is massive overinflation of alveoli followed by rupture of the alveoli. On microscopy, what we see severely dilated alveoli with flattened and ruptured interalveolar septa. On microscopy, we see dilated alveoli with flattened and ruptured intraalveolar septa, and it has got diagnostic significance. On microscopy, if we are finding this along with the froth, it has got diagnostic significance because it is a sign of vital reaction in drowning. It is very important sign of vital reaction in drowning. Hence, it is at times diagnostic of drowning, and the individual was alive at the time of death. The postmortem lung condition, it is another term which is called edema aquosum. Initially, it was emphysema aquosum. It is now edema aquosum. As the name suggests, edema means it is edema, not air. It is postmortem lung condition in drowning of unconscious or intoxicated person or old person, where the expiratory efforts, they are very less, or inspiratory efforts, they are less. Inspiratory efforts, they are very less because the individual is already dead or intoxicated. The lungs, they are filled with water and they are heavy and pale, but there is no froth at all in this condition. Hence, no wall mechanism and no push for expiration. No push for expiration. There is only inspiration and only water filled, no froth found. We also see Poltoff's hemorrhages in drowning. And what are these? These are because of rupture of alveolar walls due to increased pressure of forced expiration. Forced expiration, because as we all see already, there are attempts of forced expiration which leads to rupture of alveolar walls. Hence, small intrapulmonary but subpleural. intrapulmonary subpleural hemorrhages, which are around 3 to 5 centimeter they may be around 3 to 5 centimeter in diameter, and they are pale pink or bluish. They are pale pink or bluish in nature. Now, lungs, appearance of lungs in freshwater or saltwater drowning. So, in freshwater drowning, the lungs are ballooned, but they are lighter in weight as compared to saltwater drowning. And what is the normal weight of lungs? Please write in the comment box what is the normal weight of lungs. The lungs are ballooned in freshwater drowning, but as compared to saltwater, they are lighter in weight, and they are pale pink or pale gray in color. On squeezing, the lungs, blood from compression of the vessels by trapped air, hence uniform emphysematous appearance is there. The appearance of lung in freshwater drowning, it is uniform emphysematous. Any area of lung, if you compress, you will see oozing of blood and emphysematous appearance. The lungs in freshwater drowning, they retain their normal shape and do not collapse when placed on dissection table. They do not collapse on dissection tables. So what is the appearance? We take out lungs from the chest cavity and place on the dissection table, and they maintain their normal shape. And when we try to make pieces and press them, we hear a crepitus. We hear crepitus, and each piece, it retains the shape, and generally the table is kept dry. There is no oozing of fluid or blood by itself from the lung in case of freshwater drowning. Whereas in saltwater drowning, the lungs are again ballooned, but they are heavy. They are very heavy in saltwater drowning, around 2 kgs, and they are purplish. Here they are pale or pink. Here they are purplish or bluish in color, and they are sodden and jelly-like in consistency with pits. They are pitting, there is pitting on, when you try to press them, there is pitting. Here they maintain their normal shape. When you try to push with a finger on them, they come back to their normal shape. Here there is pitting. Impression of the pressure is there when you try to put some pressure on them, and when you place them on dissection table, they flatten out. Or when you place them on dissection table, they flatten out, and on dissection there is no crepitus absent, which, whereas it is present in case of freshwater drowning, and they do not retain their normal shape when placed on the table, or if we cut them in small sections, they do not retain their shape. Therefore, we call them like jelly-like appearance. In cases of delayed examination of the lungs or the body, after taking out the body from a water source, the froth in lungs, air passages, and over distension of lungs, all three findings, the froth, air passages, and froth in lungs and air passages, and over distension, all three findings, they are not much appreciated. Therefore, it is very important to examine the body as soon as possible. The lung changes, they are less marked, and difference between fresh water and salt water, they are less marked, because there is draining of the fluid from the lungs, because as long as the body is kept in the mortuary, there is draining of blood from the lungs. Hence, we'll find fluid in the thoracic cavity, but not in the lungs. There is something called dry lung drowning. So what is dry lung drowning? It is the death of the individual in a water body due to severe laryngeal spasm. And the signs of asphyxia, they are present, but there is very little or no entry of water in the lungs. Very little or no entry of water in the lungs, which makes the lung appears dry, and the death is due to laryngeal spasm causing asphyxia. Diagnosis of inference and exclusion. That means in such cases, diagnosis of individual as a case of drowning is by inference and exclusion of excluding other causes of death. In case of secondary drowning, what is secondary drowning? We have discussed in our previous lecture. If you want to know what is secondary drowning, please see the previous lecture. And in case of secondary drowning, the lungs are rigid, stiff, and heavy with features of acute respiratory distress syndromes. The lungs are rigid, stiff, and heavy. The hydrostatic lung, it is seen in dead bodies thrown in water. The individual is already dead and it is thrown in water, but drowning lungs with frothy fluids. It is diagnostic. If the individual is alive at the time of being in water, there will be froth with the fluid. Froth is present. That means froth, if it is present, it is indicator of ante-mortem nature of drowning. Whereas hydrostatic lung, it is seen only in dead bodies. Only water is there, but no fluid in the lungs. Going to other organs on dissection, the heart, the obstruction, because of obstruction of the pulmonary circulation, the circulation from the heart to the pulmonary area, it is inhibited. Hence, there is dilation of right side of the heart. There is restriction of movement of blood from the heart to the lung. So there is dilation of right side of heart and vis-a-vis larger veins. The blood at that time, it is fluid in nature. Why it is fluid in nature? Due to mixing with inhaled fluid and release of plasminogen activation. Plasminogen activator, it is released from capillary endothelium. Capillary endothelium of lung. Pulmonary capillary endothelium, it is released, hence it keeps the blood in fluid state. And looking at the stomach, it contains water in 70% of the cases, and the chemical and in case if the chemical and microscopic nature, the microscopic finding and the chemical finding, if the fluid in the stomach, it matches with the findings in the medium of submersion, it is a valuable confirmation of the drowning of the person in same fluid, right? And there is something called Sehart sign. So what is Sehart sign? It is the distension of gastric mucosa with soft and heavy gastric mucosa with microscopic ruptures because of over distension by ingested fluid. This is called Sehart sign. And the small intestine may contain, small going from stomach, from heart to blood to stomach, now going to small intestine. The small intestine may contain fluid in only around 20% cases, and the movement of fluid from stomach to intestine is because of peristalsis, which is seen in antemortem cases. Hence, finding of fluid in small intestine is a sign of antemortem drowning. Then Waldeyer sign. What is Waldeyer sign? Waldeyer sign is contents of stomach when placed in a container will see that there is formation of three different layers, with the base being solid and the foam at the top as per the density. If we place them in container, it is formed in three layers. The base is solid, and on the topmost part we'll find the froth. Then the brain is congested, swollen, and flattening of the gyre because of edema. Then UNO sign. What is UNO sign? It is entry of water into the middle ear. The water is water is getting entered in middle ear because it enters through eustachian tube because of violent respiratory efforts. Because of violent respiratory efforts from the respiratory tract, the fluid is getting entered into the middle ear, and presence of fluid in middle ear as is an antemortem indicator of drowning. It is indicator of antemortem drowning. It is called UNO sign. Then finally some words about the cutis anserina, washerwoman's appearance of palm and soles, pulmonary edema and hemorrhage into the petrous or mastoid bones. They can be present. They can be present in victim of drug overdose thrown in water or victim of MI collapsing in water. That means the individual was already dead while coming in contact with the water body, or drug overdose. So these things, one, cutis anserina, second, washerwoman's appearance, and third, hemorrhage. These are not an indicator of antemortem drowning. Something about drowning index, important thing. What is drowning index? It's a tool used to help diagnose drowning death. It is calculated as the combined weight of both the lungs and pleural effusion with the weight of spleen. It is the ratio. It's a ratio. So the value of greater than 14.1 is highly suggestive of freshwater drowning. It is for freshwater drowning, right? Remember, this is for freshwater drowning only. because the victim typically have heavier waterlogged lungs and lighter spleen. What is the diagnostic purpose of drowning index? It is difficult, as you know, the diagnosing the death of individual by drowning is difficult process and often rely on exclusion of other causes of death. This drowning index, it gives a qualitative measure to support. It gives a qualitative measure to support diagnosis of drowning, antemortem drowning of the individual, hence the death of the individual because of asphyxia. The significance is in drowning cases, the lungs become heavy. We all know the lungs become heavy from water inhalation, and spleen often becomes lighter due to contraction because of hypoxia. The lungs, they become heavy, and spleen, it becomes light. So the value greater than 14.1 is suggestive of freshwater drowning. Limitation, it has got limitation. That means it is not universally accepted. Why? It is not sensitive or specific. There are few institutes which say this uh, drowning index is not sensitive or specific enough, as other condition they also have similar or higher ratios. It is generally, this drowning index is generally more reliable in cases with shorter postmortem interval, right? So we again say the uh, examination of body by postmortem should be as soon as possible. Any case of drowning is not possible. Any case, any death, any diagnosing a case as a death by drowning is not possible if we do not discuss diatoms. So what are diatoms? These are microscopic unicellular or colonial algae. They are their external wall, the cell wall, they contain silica, as a result of which they resist heat and acid. They resist damage by heat and acid. They are microscopic in nature, and the size varies from around 2 micron to 1 millimeter. So the diatoms which are up to 60 microns, they enter into pulmonary circulation during drowning. So during drowning, diatoms having size up to 50 to 60 microns, they reach pulmonary circulation, and only in living body, as a result of circulation, only in living body with intact circulation, they are transported from the lungs because of agitation and inspiratory efforts from lungs to brain, bone marrow, liver, skeleton, other organs. They are transferred to many organs. And to isolate them, the best organs are bone marrow of long bones. So they are best isolated from bone marrow of long bones, because generally the bone marrow is preserved for a longer duration. They can be isolated. Also, we keep a control sample. If we are trying to isolate the diatoms, we should keep a control sample from the same liquid, which is around 2 liters, to compare the diatoms are from that area or not. And finding of similar diatoms in water and in body, it's in favor of drowning at same place, right? It's in favor of drowning at same place. But in case if it is not found, it cannot be said 100% that the individual was not in that water body. And the diagnosis of drowning is very difficult, as we are discussing. All tests, all tests may be corroborated in early diagnosis, right? We should examine the body as soon as possible without any delay, but they are not dependable on recoveries which are late. It is a diagnosis of difficulty with minimal, obscure, or completely absent finding. Hence, in a case of drowning, which is alleged case of drowning, the findings may be completely absent at times. So it is one of the most difficult modes of death to prove. It is one of the most difficult modes of death to prove. Hence, we should examine the body, which is alleged case of drowning, as soon as it comes to us. And it is diagnosis by exclusion, when there is no other thing attached or seen or included in the history, but mainly based on history and investigative reports. When they are there with the body, It is comparatively easy to diagnose, but if they are not corroborated, it is very difficult to diagnose. In cases where there are no or minimal finding, the cause of death may be given as it is consistent with drowning, right? We may write the findings are consistent with drowning, or the cause of death is undetermined. The cause of death, it is given in the, and this is kept for the end. When we are not finding anything in the body, we can write the cause of death is undetermined. So what are the reliable signs of drowning? These are fine froth at the nose and mouth, which is leathery or white, presence of weed, sand, mud in the hands, which is also called as what we discussed. It is cadaveric spasm. And presence of fine froth in lungs. Presence of fine froth in lungs and air passage. It is again antemortem indicator of drowning. Then voluminous and waterlogged lungs. It is found in both cases when the individual was alive or was thrown in water as a dead body. Presence of water in stomach, again indicator of drowning, but presence of water in intestine is indicator of antemortem drowning. And last is presence of diatoms in the tissues, and how they reach tissue we discussed in our previous slides. Then the circumstances of death in drowning. There are various circumstances of death when it is mixed with drowning. The natural disease which caused the death of the individual before falling in water first, or the natural disease while the individual was already in water. So the individual has already died because of natural disease, but the individual or the police or the agency may try to put the cause of death as drowning. The death may have occurred because of injuries before being thrown in water or injuries while in water. Injuries before being thrown in water means the individual may be in fight with the group, may got injured and thrown in water, or individual try to attempt suicide and hit some rock or some stone and injured and died, and the case may be said to be death due to drowning, while the actual cause was injury and hypothermia. The death could have occurred because of hypothermia, but it is said to be because of drowning and the cause by drowning itself. So this was all from my side on the case of drowning. The topic is covered. If you have any doubts, please write in the comments box. And thanks for patience hearing. Please subscribe and like the channel. Thank you.